And we're back. I'm your host, BKP. Good morning from beautiful downtown Blue Ridge. Yes, it's Labor Day weekend, and you know, a lot of people are busy this weekend up at the lake. This is the weekend where they wrap up their campsites, get the boats out of the water, those kind of things, head back home. A lot of people are going to be up here in Blue Ridge for the Good Samaritan Labor Day barbecue up here. Come up here this weekend, Saturday, Sunday, and Monday for the Good Samaritan. I don't even have to tell you where to find it. You will see the smoke, you will smell. You pull into downtown Blue Ridge, just follow your nose, and you will find the Good Samaritan downtown Labor Day barbecue. Thousands will be here. I'm here with Dr. Whaley. Good morning, Dr. Whaley. How are you?
I'm great. Yourself?
I'm doing great. We were talking during the break. Last night I'm watching the news, and there's been a change in the Zika virus because now we have the Zika virus actually in the mosquito. We found the mosquitoes. Let's start with that.
Well, let's start with that mosquito biting, call it pumpernickel out there in San Francisco.
Oh, you want to go back? Okay.
I do. All I gotta say.
We can get which mosquito you want to talk about.
There were 100 mosquitoes caught. 3 of those mosquitoes were found to have the Zika virus in it. That's an unheard of number. You catch thousands of them in Africa and try and find one that's got the dengue virus. So that's a really high number considering that a little bowl of
you mean water, the sample?
So 3 out of 100 is just a lot of mosquitoes, because a little bitty thing like that will breed thousands of mosquitoes. So if 3% of thousands of mosquitoes had that virus, that's a lot. Second thing about that is, it was on Miami Beach. It wasn't back over there in that area that originally was the index site, whatever that little area is called, the midtown of the Buckhead of Miami. And the Miami Beach cases, now I think there's like 6 in Miami Beach or so, but at least those 3 mosquitoes were in Miami Beach. They immediately came out and said that all visitors to Miami Beach, males should use safe sex for the next 6 months, women for the next 3 months. And I just can't imagine all those yuppies going to Miami Beach and practicing safe sex. So I was with Dr. Marlowe, the infectious disease guy, a few days ago, and he really is of the opinion that a lot of the transmission is going to be sexual. HIV began with just a few index cases, and then sexually was transmitted. We've been focusing on that mosquito. That's how they have to approach it down in Florida. They're spraying 1/8 of a mile around where they caught those mosquitoes. 1/8 of a mile is not much, but that's how they're concentrating on eliminating the virus in the community from the mosquito. But the publicity is, how do you eliminate it sexually? And that's the safe sex, and I don't know what's going to happen there. We'll just have to wait and see. Second thing came out about the virus yesterday was that there are a lot of cases now that are showing up in emergency rooms, mostly in Puerto Rico and in South America, but a few in U.S., where people have headache, weakness. As you know, Guillain-Barré syndrome, which is the paralysis, can be induced by the Zika virus, and it focuses itself on the neurological part of the developing fetus, and that causes the brain, the small brain, and the other neurological deficits. But it seems that when people have the virus and they get a real case of it, which is not a high percentage, some of them are having neurological syndromes, not just Guillain-Barré, muscle weakness or headache or whatever, and they haven't understood that yet. So there's a lot more to happen with the Zika virus. One more thing about our NFL guy. Tom Brady came out and he said, Colin, you need to go to a veterans hospital. You need to interview guys who've come back from Iraq and Afghanistan, and you'll know why you have to stand up for the national anthem. So I'm happy that somebody got up and called him to task within 12 minutes or 24 hours of that.
Well,
besides you.
Well, you know, I believe in our freedom, and I believe in the freedom. Let me see how I get this. I believe in the freedom for him to do what he wanted to do. But then I also believe that we can show him that that's not acceptable to me by not buying his tickets, not buying his jersey,
Exactly.
and letting him know, okay, my freedom, here's how I'm going to exercise my freedom from you, my freedom from the NFL. Do you make it mandatory they stand? I don't know, but I just think, how could you not?
I think you probably do, because you have an agreement with the Players Association. You haven't been with professional athletics for 45 years. The agreements on the drug testing and the uniform and everything else are tightly bound up in the agreements between the Players Association and the NFL, NHL, NBA, or whatever it is. And the Players Association has the power to do it. Now they're the ones that say you can't wear the Nike thing on your head and you can't use that little sticker on the back of your helmet. The Players Association has the power to say, for example, in baseball, the Players Association says you can't walk around with your dip thing in your back pocket anymore,
right,
because it's making kids want to dip. So Players Association has an opportunity to do that. If I do this, what other sports symbol do you remember that is Kaepernick? That's the black athlete in 1960, right, whatever
black
it was,
power.
at the Black Power,
right,
from the gold medal stand in the Olympics. He took a personal stand. He now lives in Atlanta. He's an old guy. He's 76, I think. He took a personal stand, and the amount of money that he might have made by commercial endorsements, he lost doing that. And he said that he was happy to do so, that he felt that at that time in the Black Power thing, what he did was important, and it did handicap the rest of his career, and it changed the way he lived his life, but he did not regret having done it. I think to not stand for the national anthem is a whole lot different than wearing a shamrock on your head and saying I'm Irish, or doing this Black Power thing. I was angry about it at the time, but now some 40 years later, I'm not angry about it anymore. I think I've changed a little bit, but I've got no sympathy for that, not standing for the national.
Oh, I take standing and taking your hat off. You know, I personally think it should be mandatory, but I do know this: if it upsets you, you know, walk away from it with your money and with your tickets, and you can, you know, I don't think he'll be in the NFL after this year. That's my prediction.
Well, he's not that good anyway right now.
Right.
In the National Hockey League, they play the Canadian and the U.S. national anthem, and the Players Association requires that Canadians and Czechs and everybody else stand on the blue line, helmets off, stick on the ground for both national anthems. And you'll notice at the very last note, they'll occasionally turn away, but they would never not do that. I mean, I love hockey players better than football players anyway, and I've taken care of both. But the Players Association is doggone tight about it. Listen, we got to.
Do you realize what Kaepernick is doing is backfiring, because he is firing up a group of people that are going to even work harder in this election cycle.
Yeah, I think you're right.
He's firing up.
He's hurting Hillary, isn't he? Listen, one other thing. We were talking a couple of weeks ago, when one of my staff said you really confused people when you were talking about research. I'm going to make it real quick. When people talk about medical research, they just reported a few days ago about the British physician health study. They did a U.S. one, and I participated in it. That if you ate 5 fruits and vegetables a day, you had a reduced incidence of cancer and heart disease. Okay, that's 50,000 British doctors who have been filling out forms for years, and they follow what happened to them. We call that an observational study. That's where tobacco's linked to lung cancer, alcohol's linked to breast cancer, alcohol's linked to birth defects came from. Zika virus to kids' birth defects. That's an observational study. The type of research that we were talking about the other day is where I don't know how we got into it, but we're talking about the anticoagulant thing. But when you look at the TV and it says bad drug, and there are all of these ads that want you to call up for taking a really great medicine. I take one of the new oral anticoagulants instead of the Coumadin, where they have to stick your finger. And when those studies are done, those are called non-inferiority studies. So they give people this new drug that you don't have to have your finger stuck and you can eat salads and do all the rest of that stuff. And they want to prove that it's as good as Coumadin. Well, when they do that, every one that's been done is as good as Coumadin without having to get stuck, but every one of those was a little bit better in effectiveness. So now the FDA won't let them say this drug's better and it's safer, and then the daggum lawyers get on it and they start suing people if they have any complication of taking this better drug. So it got all messed up when we were saying it the other day. That's what I was trying to say, that there's a lot of difference between Zika virus causes birth defects or smoking causes tobacco. The link between that is purely watching thousands of patients and seeing the trend, whereas the other thing is hard data. Okay, go ahead and finish.
Well, I want to go back to Zika just for a minute, because the 3 out of 100, as you say, now they multiply into thousands. When I say
they can't pass it to each other, they've got to go buy it. They got to get it from another. Those 3 guys got it from biting somebody, and they won't reproduce and pass it to their young. That's a misconception.
Oh, okay.
So 3 of those 100 had already bit somebody on Miami Beach within 150 meters. That's as big as their zone is. That's not a very big zone. That gets you about as far as from here to the restaurant down there.
Well, it's getting, and this is where I juggle with, I don't want to be insensitive in any way. It's getting national coverage, it's getting mainstream media, it's getting headline coverage. How serious is this?
It's as serious as a train wreck.
It is?
Yeah, it's really, really, really important. One, a high percentage of the mosquitoes who live on Miami Beach have bitten somebody with that virus. 3 out of 100. Well, just look, there's billions of mosquitoes out there. That says that there's a lot more cases of this disease on Miami Beach than the 6 they found now or whatever. So there's a lot more of the virus out there than they know. Remember that the only way they're finding the virus is going up to people at the store or their home and saying, do you mind if we test you? Well, if only 20% of people are going to want to be tested, say, no, I'm not peeing in a cup or letting you draw blood from me, knocking on my door. So they're not getting everybody that lives there. And when they do that study and they do 100 people, 205 people, they found 40 cases. And none of them had ever been sick. So there's a lot of that virus in Miami Beach and the rest of Miami. And well, now we know it's in Tampa, St. Pete, because they've got it in Tampa, St. Pete. And those people are not going to be sick. The young ones are going to have sex with each other. They're going to pass the virus to somebody. That woman's going to get pregnant. And there's going to be a huge number of birth defects that the public insurance, public welfare are going to have to take care of. I mean, insurance premiums are going to go up. They've already, the Red Cross has already said we've got to test every unit of blood donated in the United States. They said every pregnant woman in the United States should go to her primary care physician or her obstetrician to be screened for the Zika virus. Well, what does that actually mean? It says if you travel to this place in Florida, but your doctor can't test you. You don't go in there and just get a blood test that you send to the lab downstairs. You've got to send the urine or the blood to the CDC. They don't have room to test million pregnant people, So it's just a.
But that is coming down the road that they want.
Well, they don't want them tested. They want them screened. It's like when you come in the United States, they say, or every time you go to the doctor today, in our office, we got a big sign. Have you traveled to Sierra Leone or Eastern Africa? Well, the answer is no. Well, you have just been screened for Ebola. That's screening for Ebola. So screening for Zika is if you've been to Miami Beach, Miami, or Tampa in the last 8 weeks. And having been there, have you had a fever or had a headache or whatever? That's screening for Zika virus. But if you said yes, then they want you to get your blood and your urine and send it to the CDC. So that's sort of where that's
Well,
going.
you kind of touched on something there when you said insurance companies and testing. What about the health insurance industry in itself with Obamacare and the Affordable Care Act and these exchanges? I mean, there's exchanges leaving left or right, getting out.
I think there's only going to be 4 providers in Georgia this next year that are going to take care of Obamacare, and only 1 is statewide. And there were 11 or so a few years ago. I just don't see how it can survive. You have let's go to the EpiPen. The people that are on Obamacare and have so many limitations, that EpiPen is absolutely life-saving to the guy with a peanut
right.
Allergy. Obamacare can't afford to pay $600, and if that lady lowers the cost to $300, they still got to buy that EpiPen. And as I said last week, you got to have skin in the game, and until they can figure out a way for national health insurance to have everybody have skin in the game, so that there's some way that you're participating in your own health care, I don't think it's going to work. But yeah, the exchanges are going out. The number of people that can get Obamacare is, at least in Georgia, is going down, and the premiums are all going up by double digits. So we can't continue it.
Well, this is actually according to Obamacare, in a way they wrote the legislation. This is the big year for it. This is where a lot of the things unfold, a lot of the new taxes, a lot of the increases, and this is the year everything unfolds.
Well, remember the supplements, those huge supplements got started. Those supplements got a sunset provision in them.
I seen something the other day where is it the CBO, right? They have scored this. They said they missed it. Huh. I wondered. They said they had missed it because the rate of enrollees that were anticipated, was off, so they kind of missed.
Well, not only that, but they got the demographic wrong. They thought they were going to be enrolling a lot of college-age kids and kids up to age 30 who are really healthy and don't use any health care. And they ended up getting a bunch of people our age, who got high blood pressure and diabetes and flat feet and need a knee replacement. So they didn't have enough employed young people paying premiums and not using it to be able to pay for the people that got it, that needed insurance and are paying low. That's why the huge deductibles now in so many of the insurance plans. I mean, my deductible's $3,000 a person per year. I mean, yours probably $1,500, $3,000. That's the result of what happened to the Obamacare.
I will tell you this: when it comes to health care, you could sit in every year. You could sit in every county commission. We'll just pick county commissions. This is all the way down, and they get presented by their carrier, their health carrier, and it's going up X percent, and you have commissioners looking and saying, okay, well, what do we do with our county employees? I mean, they're not going to want to go up $42 a month on health care. How do we keep them the level of care and not go up to $42? Their deductible goes up. Well, we can raise their deductible from $1,500 to $5,000, and this is what you're hearing in these rooms. Right.
Well, and the other thing they say is
that's happening all over.
Right. If the county employee's spouse has a job, then they aren't going to be eligible for the county health insurance. The spouse has got to get their insurance from their employer, and that way you shed part of the.
But that's happening every year.
Yeah.
I have sit in these rural counties here in Georgia. We cover rural counties, and I've sit and heard their health care go through the roof. Absolutely through the roof. And I always say, it's your money, it's your tax money that's paying all those health care costs. And the only way they can get the people to continue to have the same level of care that they're getting, or coverage, is to raise those deductibles through the roof. So, I mean.
Yeah, at the end of the day, they got to raise our taxes $1 or $2 million. They got to take in more money. They've got to either do less on the highway. They've got to do less with their fire department or something. So I mean, every squeaky wheel needs to be greased. I mean, we've got to have our roads cared for when it's a snowstorm. We don't want to have the fire thing bang and those guys over there have a bunch of flat tires. And we don't want people leaving, good people leaving the county's employ to go to work for General Motors or Delta because their health insurance premium went up, but their salary didn't meet it, or their deductible went up, but they didn't get any salary to be able to pay the deductible. Otherwise, that's groceries.
If my county commissioner comes to me, and I'm talking to me as a citizen, and says, hey, we have to have more money because we need another truck, well then, okay, we got to have more money, we need another truck. But they're going to the people and saying we have to have more money. I'm just saying this in general in a lot of these counties because you're not seeing our health care costs. That is a problem.
Yeah, that's a terrible problem.
They come and say they
well,
need
it's
another
going to be
truck
it's going to be worse with
another...
Mrs. Clinton.
Huh?
It's going to be worse with Mrs. Clinton.
Well, I've got to stay on. I got to stay on schedule. I've got a couple other things,
right.
But I want to ask you. I want to break this down. And I want to put it this way: as a veteran, we touched on, but as a veteran, when you see somebody like a Colin Kaepernick, and I heard what you said, Tom Brady said, but I want to hear what Dr. Whaley says this morning. How does that bother you? What do you think when you see a young man that is a multi-millionaire, that through sacrifices much like your own?
The guy's got a right to be an ass. And
write that down, Lonnie.
I
have a right.
The guy has a right to be an ass. I think that an NFL player, and I look at the guys that I've known that are really good role models. White Shoes Johnson used to go and give talks with Jane and myself on drug prevention. Edwin Moses used to go and give drug talks with us. We knew both of them well. Those men were great role models for black kids from a ghetto region. Kaepernick is not a role model. He's got ink from his ears to his fingers. He looks like a 1920s sailor, and I think he has an obligation to the youth that are wearing his jersey to not do the Johnny football this and when he does something like that, I think he hurts the sport. He hurts athletics. He hurts the kids in San Francisco who are worshiping him, and it's a tragedy. He needs to go to that church in Texas where Jane's mama goes that has the ex-football player preacher or something, where somebody can talk to the kid. I don't. Yeah, I asked that guy. I said, "Are you going to be able to work with Johnny football?" Because Manziel's from the same area. He said, "If somebody would ask me, I'd go anywhere in the country to work with him." There are people out there that are such great sportsmen and have been there, that are fine people, they're Christian people, and they're patriotic, and they can go work with Kaepernick and please salvage the guy. Salvage the guy or get him out of the NFL.
Dr. Whaley, I always enjoy it and appreciate it, and I always go away learning something. I was telling somebody the other day that's just one of the joys I have. I always go away from our time learning something. Remember, as Dr. Whaley says, Mr. Kaepernick has the right to be first name Jack. There you go. First name Jack. Has the right. That's America, folks. Hey, we're here with Dr. Whaley. Thank you very much. We're in downtown Blue Ridge, Tupelo T. The new Blue Home and Gift and Broken Bull where Zach Brown's mom shops, bought that hat. We'll show you in a minute. What's going on in downtown Blue Ridge? What are all the opportunities to take advantage of this holiday weekend? We're going to talk about that for 4 or 5 minutes before we
didn't hear the train whistle.
It's not 9 o'clock.
Okay.
Well, it's almost time for the train whistle.
Almost time.
You got me to thinking, wait a minute. What did happen to the train whistle?
All right.
We're almost there. We will hear the train whistle in a minute. I'm your host, BKP. We'll be right back after these messages.